So this is our gynecomastia patient. It's been more than a year since he had his procedure done, and he's very kind enough to talk to us today and tell us about his journey. So first of all, thank you so much for doing this.
Well, Dr. Aniga, thank you so much for speaking with me today. It's a pleasure to share my experience. I'm happy to do this.
Thank you so much. So when did you first become aware that you have gynecomastia?
Actually, a very long time back. I think it was in my early 20s, maybe late teens, when I began to get a sense that this is there. But at that point in time, I didn't know exactly what the issue was. It was just something to be conscious of. I thought that I could exercise it off, and something that might go away in time. It looks a bit like baby fat, and people said that it'll disappear. But it didn't quite happen in my case. I had been exercising, running, working out very regularly, but it didn't seem to eliminate the problem. So it's stuck with me for quite a while now, more than 16, 17 years, I think.
So what were some of the issues that you were facing? Like, for example, were you able to find the clothes that you wanted? Were you able to wear the clothes that you wanted? Did you have any inhibition about taking your shirt off in some situations? Anything like that?
Yeah. Well, absolutely. I think that's a very important question. When you have something like this, you're constantly anxious being in certain social situations, particularly when there's a lot of crowd around, particularly when you're on stage. As somebody who enjoyed and relished being on stage, it was something which was a problem for me, because that it shows that you're a little bit nervous when you're on stage. My job also requires me to be on stage as well. So that was one issue. The fact that at the back of your mind, you always have this distraction. As far as clothes are concerned, certainly, there are. You can't necessarily keep up with the latest trends, because they change, and therefore you're very confined to what options you have as far as the clothes that you can wear are concerned. You have to be covered up, you have to wear thick layers, and it's not always very conducive.
So you mentioned that you went to the gym and all that. So when did you finally decide to seek for some kind of medical management?
I think so we did this 2 years ago. Actually, 31st of May 2019 was when it happened. Very, very close to being 2 years now. My schedule sort of caught up on me. I felt that I was spending too much time exercising and running behind this problem. And it was taking away a lot of my time and effort from what was important for me, which is my profession, my time with my family, time at home, and so on and so forth. That was really the trigger. And then I did some research on it, few months leading to the procedure. In fact, I had met you and Dr. Jayashree also a few months before. In fact, a year before, I think we did it. So it took a long time for that decision to be made. And I've been doing a lot of research on what the problem is and what the solutions around this are. And it seemed to me that it's a very solvable problem, very common problem, and it's not worth living with it. It's you can very easily be solved. So I think about 3 years ago, I felt that it was the right time for me to do this.
So obviously, when someone is undergoing any kind of surgery, they have they're obviously nervous about it. So what were some of the concerns that you were having when you were thinking of undergoing the surgery?
The long-term repercussions was a concern for me, and so one of the questions which I posed to you and to Dr. Jayashree also was, well, what would be the ramifications once I get it done? Will I have a new problem, having solved this one problem? At the outset, that was really my concern, but then in time that concern was no longer there, because there is no new problem that gets created.
So what made you finally decide to go ahead with us for this surgery?
I spoke to a few doctors. I think there are a couple of reasons. Number one, I got the sense that the approach is going to be straightforward. That was number one. Dr. Jayashree and yourself were both very very reassuring. I had tried some other clinics as well, and it seemed to me that in some cases, the process was a little bit more complicated than I would have liked it. These are the two main reasons. In addition to this, I also like the fact that it was close to where I was. And as far as the commercials were concerned, it seemed to me a little bit manageable. All right. With respect to some of the other clinics.
All right. So, as you obviously know, one thing which we do differently is that we do this under local anesthesia. So, where you are completely awake during the surgery. So, can you tell us a little bit of what that experience was like? Were you a little apprehensive about it? And did you face any issues with it?
Well, thanks for bringing that up. In fact, local anesthesia was one of the issues which was appealing for me. I wanted to be able to be aware of what was happening. And in fact, for me, that wasn't really an aspect of concern. It was something which is a benefit as far as this procedure is concerned. But I think when you're going through the procedure, it's always very odd when something's happening to you. Right. So it's a very natural apprehension to have. And I would be honest, I did have a bit of that, but I think it was just because it's something very odd which is being done to you. I think it's primarily because of that. There wasn't a lot of pain because I was awake, but you can certainly feel that something's being inserted into you, and there's a procedure which is happening to you.
But it wasn't too bad. It was manageable. It was not something unbearable or anything like that.
Not at all. Not at all. And I think the your experience and the fact that the team around me was calm and composed, that really helps.
All right. Thank you so much. So now, immediately after the surgery, the day off and the day after, can you take us through that process, what it was like?
Yes, absolutely. One is that you're excited that it's over finally, and that and the recovery can begin. But I think for me the point of most concern actually happened after the procedure, because you look very different. You're not used to looking at yourself the way that you appear in the mirror right after the surgery is over. You shrunk a little bit, and you don't have that fat anymore. You still have a few marks from the procedure. So at that point in time, I was a little bit concerned, but then all those concerns again, they disappear after a while. I think it's a matter of 3 to 4 weeks, 3 weeks maybe, when you begin to see a little bit of that shape and the normalcy coming in your chest. As far as the compression vest is concerned, as you're guided, it's useful to wear that for at least 2 months. By 3 months, I think I had it for 3 months, as far as I recall. It was a little bit of an odd thing and a discomfort that you have to go through, but after that, it's great.
But was it painful after the surgery?
Not at all. Okay. Not at all. The compression vest is a little bit heavy. Okay. Right, as it sets on you. So as a result of that, yes, you do have a little bit of discomfort for the first night or two. And keep in mind that you're already a little bit nervous about what has happened, so you're breathing heavily. Right. So a combination of these two things makes you a little bit uncomfortable and nervous. There's no doubt about that. But then that subsides after a while when you begin to see that those improvements are taking place.
And when did you go back to work after the procedure?
I was back to work, in fact, immediately. We did the procedure on Saturday. On Monday, I was back to work.
All right. And on a more long-term basis, when did you start really seeing the results, and what was your impression at that point of time? What was your feelings at that point of time?
Actually, not too distant. I think the compression vest came off in the 3rd month. In fact, I had started to see results even before that. Towards the 3rd month and maybe getting into 4th month, I had let go of the compression vest, and I felt great. It was exactly how I wanted to look, because I had been exercising quite regularly before the procedure, and I continued that after the first 3-4 months over. I began to get cut in a good shape. So I think by the time the 6th month came along, or the 7th month came along, I was pretty much where I wanted to be. A year down the line, 2 years down the line, I still feel that the results are great, and I'm glad.
Are there any marks? Did anyone come to know that you've gotten this done? Anything like that?
I don't think anybody knows. In fact, anybody who's seen me in close proximity also does not guess that I've got it done. But yeah, of course, if it's really an incision which happened, so that's that mark does not go away. I wouldn't really necessarily call it a scar because that it seems like a scar looks like it's larger than what it is. It's just a mark which is there.
Yeah.
And you can only see it when you see it from up close.
Yeah.
Even if you take a photograph, say at the beach,
yeah,
a few meters away from you,
yeah,
you can't make it out.
So someone really needs to know that you had this. And need to go looking for it for them to be able to find it.
And also ask the right question. They need to ask you, well, what is this? They might even dismiss it because it doesn't seem that odd. It's not a very odd thing which stands out.
Yeah. And so, how would you say this has changed your life? How would you say it has made things better for you?
I think in a very substantial way. I don't spend that much time now on thinking how I appear.
Mm-hmm.
And I don't have time to deal. I wouldn't have to deal with that anxiety that used to happen earlier. So my mind is just freed up. I can focus on a lot more productive things. I can be a lot more confident when I'm speaking on stage, and that makes a big difference. Because if you're trying to convince somebody, if you're trying to make a sale, for instance, if you're trying to make a speech, it's only more effective when you're confident. And so from that perspective, I think both personally and professionally, it's made a dramatic difference, I think. It was a fantastic decision to make, and I'm glad the procedure went very well.
I'm very happy to hear that. And lastly, do you have any message you'd like to give for other people who are thinking of undergoing this, but they're a little bit scared about it, they're a little bit unsure about it? What would you say to them?
Well, I would say in short, don't think about it and just get it done.
All right.
It is, you will spend way too much time being concerned about it. The procedure itself is not such a huge inconvenience or a complication, but the benefit that you get after that is substantially much greater than anything that you have to endure for just a very short period of time. It's a very simple procedure. It's a very common procedure. I would, in short, my advice would be don't think about it, just get it done.
Excellent. Thank you so much for doing this. I really appreciate this. And I know that all our patients would also appreciate this. I mean, it's one thing for me to tell them, but when they hear it from someone who's already undergone it, that just hits differently. That just, it eases their anxiety in a big way. So thank you so much for doing this.
Well, Dr. NK, thank you so much for speaking with me. I'm glad to share my experience as well. And I really do hope that it makes a difference to anybody who's considering this. Because at the end, it's we've all been through that pain, and I can sort of empathize with it, and I certainly.
All right.